Hello, podcast listeners. We know podcasts are a great way to catch up on a program that you may have missed on KSJE, and it's provided as a free service of this radio station. But you know, KSJE is now listener supported, and so while you enjoy this podcast, we hope that you'll also take some time to join KSJE. Become a member today. It's quite easy to do. Just go to our website at ksje.com/support and pick the level of support that best matches your budget. Thanks again for listening. Here's your podcast.
Now back to Studio A and the award-winning Scott Michlin morning program on KSJE.
Back in the studio this morning with my guest, as I mentioned, from the San Juan Health Council. Amanda Evans is here with us this morning. Good morning. Welcome back to KSJE.
Good morning. It's so great to be here again.
Thank you for coming back in to remind us all about the work of the San Juan Health Council and the work that you do and that the Health Council does. Of course, we remember the Health Council by having the Health Expo earlier in the year, right? That big health fair and much, much more.
Yes, that was our third annual one back in February, and it was great. We had over 100 vendors. We had about 850 community members, I think. Oh, no, that was the year before. We actually had over 1,100 people come out this year.
Wow, yeah.
So we've had a really good year.
Very good. Well, congratulations. I imagine you're working on your number 4?
We are. We're already starting planning for that. Yeah, we've got working with McGee Park, getting dates set up, starting to get some interest out there for vendors, because I know some people's calendars fill up fast, and so we want to make sure we get information out and get people hearing about it and ready to go for next year.
Okay. Same time of year you're planning for, we'll at least early in 2027?
Yeah, so it'll be
I'll put you on the spot here.
I know.
Make you look it up, right?
We do have a date.
Okay. That's all right. We'll let you get a minute to look it up. And,
yeah, that's my own fault for not being prepared this morning.
No, that's
that
okay.
Happens.
Well, it's almost, what is it now? Almost, 8 months away. So
yes, it is a little
bit of time for folks to figure it out. But if you want to be involved, now may be the time to start planning.
Yeah, so February 20th of 2027, we try to do it. Okay. The first year we actually did it in January and realized that was a little fast for people to get information after the holidays, because everybody's still kind of, reeling from all the festivities and stuff in December and January. So February gives us a nice start to the year. And we know what really started this is we talked about how so many people set New Year's resolutions and want to be healthier in the new year. And then it's really like that February time when kind of starts seeming a little harder and kind of starts falling off. So this was really geared towards letting people come out and find opportunities to kind of help their goals and keep pushing through. Okay, very good. So February 20th. Yes. That's folks can start thinking that and putting that on their calendars for the Health Expo 2027. Yep. Very good. So remind us about the work of the Health Council. This is a kind of an organization that tries to bring together a lot of groups and nonprofits in the community, right? It's something that is supported by the state. Right. So this is a really great program, organization, community group. It has a lot of different kind of connotations, but other states have public health departments in every county. We are lucky here in San Juan, we have a public health office, but not every county in New Mexico does. And so what came about, probably 30 years ago or so, was that they started seeing there was a need for planning around health services in each county, even that didn't have the public health offices. So they started at the time what they called maternal child health councils, and it was really focused on building up moms and babies and young families. And then in the early 2000s, they really decided it needed to be more broad-based. And so that's when they turned into what we kind of know now as health councils. And so we focus really now on all aspects of health. That's why we do like the expo, is because we bring in mental health, physical health, even things like transportation can be part of health. Can you get to a doctor? Senior issues, youth issues, all these different pieces, housing. Some people, when you say health, they think, well, I went to the doctor and that I'm healthy. And
Right.
so health is so much more than that.
Sure, very true. And of course, we appreciate the partnership with the Health Council because for I don't know how many years, you probably do, that we've been doing monthly spots with the Health Council. A representative will come on and talk about the work that they do, maybe an organization that's a member of the Health Council, or you or someone else who's more involved in the actual Health Council part will come in and talk about the work that you do. And we really appreciate that partnership and sharing the work that you all do with the community as well.
Yeah, I think we figured out last year was 10 years. So I think
Okay.
we're going
Wow.
into 11 years now of partnering with you.
Right. I should have given you a watch or something. I don't know.
I know.
Right.
We deserve, we should have done a whole big
anniversary
thing.
show,
Yes,
right.
yes. We'll do that when we hit 15.
Okay. Sounds good to me.
And so, yeah, we've been doing, we really want to focus on our members. We started it because we actually have called it for years the Positive Wellness Campaign, because we really saw a need for the positive stuff our community is doing around health, because sometimes the media, and not here, not you,
Okay,
but
all right, fair
other
enough.
media sources can sometimes get a little negative about what's going on in the community and not see the really great services, organizations, just people in the community that are making a difference. And
Sure.
so we try to highlight that every month.
Yeah, exactly. Well, and I think, it's helpful for the community to hear those positive stories too, because I think a lot of folks maybe just, they go to work, they come home, they raise the kids and they deal with that. And then that's really their life, which is really important, and they're really busy, but they don't have time to pay attention to maybe some of the other things going on. And then maybe they'll say, well, why isn't someone dealing with X and what's going on with Y and these problems, and my kid's getting now in this wrong crowd or whatever. And maybe by hearing some of these conversations that we have with members of the Health Council, they're like, oh, there is someone working on this problem X, or dealing with kids who are in the wrong crowd, or prevention, things like that. And so I think that's important messages to share.
No, I think that's one of the things. I mean, I've been with the Health Council over 18 years now, and it's still something we're trying to address, is how do we get that information into the community? And this is a great avenue because it's local and local people are listening. And so we really focus on it. It's so important to get the knowledge out, even for other organizations. We've made one of the big things with Health Council meetings, we meet monthly, is that it gives organizations an opportunity to come together and hear about other organizations. You might be working for someone who does housing, and you're trying to get your clients transportation, and you make that connection at a meeting. Or you might hear one of the shows where someone's talking about an issue and you're like, oh, I need that for my clients, or I need that for my family if you're not an organization. And so those connections are a huge part of how we make the system work.
Yeah, exactly. So anyway, we're grateful for the partnership and the work that all members of the Health Council are doing. And you're always open for more members too, right? It's really not a limited membership type organization.
No, this is open to anyone, and it does not have to be an organization. If you're someone who just cares about a topic in the community around health or health in general, our meetings are completely open to the public. They're held the third Thursday of each month down at the PMS Community Marion Oil and Gas Community Room. It's from
the Community Health Center
Yes,
there, PMS.
yes.
Mhm.
And so it is 3 to 5. We try to end before 5, but we try to leave some time at the end for some networking and just making connections. And we have presentations some months. We have discussions on topics. We have work around our projects that we're doing. We just did we've been working on behavioral health this year, and just created a new training around behavioral health, the 8 dimensions of wellness and how you can incorporate that into your life. And so kind of all of that goes into our meetings, and you really have a place to connect with people and find out what's going on in the community.
Yeah, which is great. So
Yep.
again, important work that the Health Council is doing, and again, always looking for other areas, I think, too. And so with the funding that you're able to get to run this, it's not a lot, I understand, but the funding that comes from the state, is there other directives from the state too about we'd like maybe to focus on this area this year or this area next month, or things like that? Do they give you some goals or things like that they'd like to see?
They do. And they also, what's great about the funding we have, it's through the Department of Health, is that they really give us some direction on what's issues are coming up, but also leave some room for us to decide what our communities need. So there's a really good balance there. But so when we had funding back, in the 2020 and around there, we were kind of focused more on COVID and getting information out about all the different things going on then. And now we've kind of shifted as a state more into behavioral health because it's such a huge issue. And so there's quite a few programs the state has kind of put through to help with behavioral health, and the health councils are an integral part of that. They're working with some of these other grants to make sure that the priorities for each region is really heard at the state level. And so, yeah, our focus this year has really been on mental health, which is really wide. It's, behavioral health, which is encompassing mental health, substance use. There's a lot that goes into that. And so we've kind of taken on looking at it from kind of a preventative side. How do we keep people who are, some of our organizations where we have a lot of burnout in social services because it's such a tough field, you're dealing with so much. How do we keep them maybe healthier? I did a training with some organizations through our Creating Cultural Harmony conference that the partnership does, and we helped sponsor that. And I did a program, and I had several teachers come up and said they're going to start using that concept in their classrooms with their students on how do we really show them how to start their lives with healthy habits and things like that.
Right. Very cool. Well, that's important to know. And so there's some things planned for the year with the Health Council on these different areas of focus?
Yeah, we're going to be having a meeting in June. I don't have a date for that yet, but if you're interested in keeping up with the Health Council, we have an email, which is SJHC, so San Juan Health Council, but just the initials, at sjcpartnership.org. And people can email that and get on our email list, and that'll be where they find out like upcoming stuff. Or we also have a Facebook page, San Juan Health Council.
Right.
And so we'll have a meeting in June about kind of some of our projects we've been working on, it's kind of like an annual meeting where we give people updates on the Health Council. We'll also be talking about some planning around behavioral health stuff for the coming year, since kind of our funding switches in July. But we'll have another expo next year. I'm getting requests for the 8 Dimensions of Wellness training. So I'll be out doing that. We've got a lot going on.
Very good, very good. And of course, the Health Council is somewhat connected to the San Juan County Partnership. The partnership is kind of the fiscal agent for the Health Council, and that's kind of the connection. You also work for the partnership, full disclosure, and so there's that as well. And they kind of share you to do Health Council stuff from time to time.
Yeah, that gets confusing for some people because they don't understand those connections. But like I said, I've been with the Health Council for 18 years, but I was hired at the partnership because they were holding the fiscal contract to be the coordinator for the Health Council. Right. And so over the years, things have merged and kind of woven together. And so I do work for the partnership, and then I also coordinate for the Health Council. And the partnership is the fiscal agent and really has put so much time and energy above what we get from the state to make sure this is running smoothly and keeps going through whatever happens.
Right. So. Right, true. But for both organizations, I would say the goals are fairly similar when it comes to prevention and getting education out to the community, whether it's the partnership or the Health Council.
Yeah, and they really do. They share really similar missions on how they want to do things and visions for the future. And so I think it's a perfect dovetail into each other. It works really well to have the partnership who has kind of a wider focus even and more direct service. They're able to provide, housing assistance, and we have LEAD there and Healthy Kids and all these programs that are really out in the community doing it. And then the Health Council and some of our other coalition work has really been to bring that planning aspect together to that hub where people connect.
Right. Right. And when we talk about the planning and the things that you all are doing with the Health Council, do you think that's been somewhat helpful in maybe convincing some of the other entities in the county, like the county government, the city governments, the hospital, to say, and Presbyterian Medical Services and others, that maybe to come up with some of these programs that we now have in the community, like the Community Compass or the Navigation Center or things like that, because of the work of the Health Council that says we have a bunch of individuals that are suffering in our community. We could really use X. What do you think we could do to try to solve this issue or provide this service to the community who are needing these services?
Well, and I think we have a really great county overall, and we have some really great people in our governments, or our local governments, that are working really hard. So I wouldn't say all those ideas came, from the Health Council, but we've definitely had some impact on the work. When the Sobering House and the JIP Center were created years ago, we did a health study. Worked with another grant we had to do a health study on what the roadway, what dangers might be on that. And some of the work that came out of that has led to lighting being put up there, or different issues. They go back to that document still, like, what was recommended to address that. And then there are, healthy kids, healthy communities. I know you've had Patience on here before talking about
Patience
that.
Williams, yeah.
Yes. She's really involved in the community, and that grant really came to the partnership through the Health Council. We were approached to bring it to our community many years ago, and that was really, we kind of made that connection between having the partnership hold that grant and be a fiscal agent there. So I think we have a lot of people in the community doing really great work, and we're just one small piece, but I see us making a difference.
Right, I do too. And that's, again, and I think by having these monthly meetings and these conversations of bringing folks to the table, I think that's how those conversations start about, wow, there's this grant that's available, who could apply, or what organization maybe fits that could maybe take this grant and run with it and bring this program to the community.
Yeah, and I think that's so important, because as a community, we don't want to be competing against each other or duplicating services. We really want to be working together, and how do we make those programs work? And if there's a program that's not being supported, how do we get them support that they need? And so those tie-ins are all about connecting with each other and knowing what's going on with other organizations, just in the community as in general.
Right, which is really important. And again, part of the membership of the Health Council, and the goal and the mission and vision of the San Juan Health Council as well. And so moving forward with the group and the members of the council, again, it's open to anyone to come to the meetings and be a part of these ongoing conversations. But you talked about some of the goals that you have for the year. Are there some other things that the board would like to see happen with the Health Council, a bigger group, or just keep moving forward with other projects like the Health Expo or other things like that?
Well, we're always looking for growth. I think that because really the biggest thing with whether the Health Council succeeds or not is people showing up to the meetings. Even the expo, I can't do that work by myself. I have Rick Griffith is from NMSU Extension Office, is our chair, and he takes on a lot of that work, but we have other people that we reach out to and make connections with. The hospital is our main sponsor on that, outside of our DOH funding, and just all of that takes people. It takes, we do not get enough funding for me to do everything.
Right, sure.
So we, the Health Council, really the people who show up, some of them are doing it because their job requires it, but a lot of them are just taking their time because they care about the community to show up and make a difference.
Yeah, very true. Well, and again, it's really important that folks, I think, realize the work that the Health Council is doing in the community through events like the Health Expo and things like that. So that's really important as well. Just a couple of minutes remaining this morning, and so before we go, other things you want folks to know about the San Juan Health Council and what the work is that you're doing throughout the year?
I think the biggest thing is encouraging people to come to a meeting. We'll have one in June, the third Thursday. We try to be really consistent so that, we've had to cancel a few, but we try to make them go out, have them year round so people can show up when they can. They can always reach out to me at the partnership and get more information. If, you're not feeling comfortable just showing up to a meeting, I will be happy to sit with you and kind of explain more of what we do and things like that. And just getting more organizations involved, getting more people. We are really looking forward to just the huge number of vendors. We're almost maxed out. Next year, I think we had 105 or something. And Rick is my logistics person, so he's the one that gives me a number and says, this is our max. Okay. Or I would just put them in everywhere. But sure. I think we're going to have 120 as our max for that space. So people are going to we'll start sending out stuff at the end of the summer, and we'll try to get people signed up and make sure everything is really flowing and just keeping everything everything going.
Okay, very good. And just one other note is the Health Council, again, is made up of large and small organizations. You mentioned the hospital, certainly, which is one of the biggest organizations and employers in the county, but I would imagine small startups or small community nonprofits and things that are maybe just getting started, they're also welcome to be part of the Health Council too.
Oh yeah, there is no requirement whatsoever. Like I said, if you work for the hospital, if you work for any of the large organizations, if you're just a one-man show and you've just started something around health, we would love to have you. If you are just a member of the community and work in a field you think is totally unrelated to health but want to show up, we would love to have that.
Okay, very good. Excellent. And again, Facebook page is a good place to go for information or contacting you at the San Juan County Partnership, or the email address for the Health Council.
Yeah, we are hoping by the end of summer to have a website set up. So we'll be announcing that website and that'll give people kind of a more consistent place. We have some information on the partnership's website as well, but really Facebook and the email is the best way if you want to get meeting reminders.
Okay, and repeat that address for us, the email address.
It's sjhc@sjcpartnership.org.
Got it. Very good. Amanda Evans, thanks for coming in. Good to see you.
Great to be here.
Appreciate you coming in very much. That's Amanda Evans from the San Juan Health Council, my guest here on KSJE. Did you enjoy that podcast? We hope that you did. And if you did, share it with your friends. And if you really want to keep podcasts like this coming, please support KSJE. You can do it easily online at ksje.com.